Good evening, and thank you for joining us at Emmanuel Chapel's 7th COVID-19 webinar. We will be discussing biosecurity, emergencies, and COVID-19 disruptions. For those who are not in the medical field, I'd like to say a word or two about biosecurity, and I'll start by putting on a short presentation on today's topic. Biosecurity essentially is a series of measures a nation takes to protect against the entry and spread of dangerous infectious diseases. As you may be aware, Nigeria has faced several epidemics of dangerous infectious diseases, including yellow fever, avian influenza, Lassa fever, Ebola, and now we have COVID-19. What is peculiar about COVID-19 is the fact that, and Ebola, is the fact that they both came through our airports. So it begs the question, who is in charge? And what are we doing in relation to our public health policies and laws regarding biosecurity? The Nigerian Center for Disease Control is the country's primary public health institute with a mandate to lead the preparedness, detection, and response to dangerous infectious diseases. And the Quarantine Act of 1926 is the primary legislation governing the suppression and prevention of dangerous infectious diseases in Nigeria. The law provides, amongst others, that the president can put in place general quarantine laws like we saw recently in Nigeria. He can also restrict interstate travel, as we've noticed happened. And he can also put restrictions on international travel, which also took place in Nigeria. In addition to that, he can also prescribe duties to officers that may be charged with carrying out certain regulations. The Act also permits state governors to act in like fashion within their states to the extent that any of these regulations are not acted upon by the president. Now, being faced with the immediate danger posed by COVID-19, both federal and state governments employed a wide array of responses to curb the spread of the virus. But unfortunately, there was a lot of economic backlash, and a lot of this had to be reversed. So we had to minimize the damage to the economy to preserve, to move on. So today's webinar is focused on the following areas. First, the state of biosecurity in the country and any attempts to update our laws on preventing and containing dangerous infectious diseases. Second, the implementation of and extent of powers under the Quarantine Act. In addition to that, the webinar will be looking at, the purpose of this webinar will be to look at the rights of citizens under the Constitution to movement, association, work, and religion. And our plan finally is to avoid a long and painful recession as a result of this pandemic. Ladies and gentlemen, thank you for joining us today. And today we have a distinguished panel. The first person that I'll be introducing is Right Honorable Femi Gbajabiamila. Honorable Femi Gbajabiamila is a lawyer. He's a most distinguished legislator, and he is the Speaker of the House of Representatives. He was the minority leader of the 7th Assembly and the majority leader of the 8th Assembly. I'm sure we all know who Mr. Femi Gbajabiamila is. Thank you for joining us, sir. Thank you.
Thank you, Bolande.
We're also joined today by General Lucky Rabo. He's the Chief of Defense Training and Operations at the Defense Headquarters. He's also the Chairman of the Armed Forces COVID-19 Task Force. He has also served as the Nigerian Army's Anti-Boko Haram Operation Commander. It's lovely to have you here, General. Thank you.
Thank you very much. It's my honor to be here. Thank you.
Thank you so much. We're also joined today by Professor Akin Abayomi. the Honorable Commissioner for Health in Lagos State. He's a specialist in internal medicine, hematology, biosecurity, environmental and human development. He's rushing to join us in a stable space, so I can hear movement in his car. Professor, lovely to have you here with us. Thank you.
Thank you very much. Pleasure to be on the panel.
Thank you. And finally, we have Professor Abdulrazak Garba Habib. He is an infectious and tropical diseases physician and the chairman of the Kano State COVID-19 Task Force. He's also a COVID-19 survivor. So thank you all for coming today, and it's really a pleasure to have you here, and we hope that we're going to have a fruitful deliberation this evening.
Yeah, thank you.
Thank you. So
Thank you.
what I'm going to do now is I'm going to allow each of the panelists to give us a 2 I'm going to ask the panelists to give us a 2 to 3 minute presentation, like a general overview of their thoughts on the topic today. The topic, again, I repeat, is biosecurity, emergencies, and COVID-19. I'll start by calling on Honorable Bajabi Amela. Thank you.
Thank you, Bolanle, and thanks for having me on this program. First of all, let me say, like we all know, this is very topical, and we're going through an experience like never before, and hopefully we never will after this. I've always believed that great nations are determined and they survive by how they respond in times of emergencies like this, and in times of adversity. We are at war, and I believe that that's agreed. Although with an unseen enemy, we don't know what the enemy looks like. We don't understand the enemy thinks, and that's why it's called the noble virus. And we must respond accordingly. We must respond. If we agree that we are at war, we must respond like we are at war. In my office, as is the office of the Speaker, the House, we've set up a post-COVID response team. We'll go into the details of that later. But we've dealt with several things. We've set up a COVID ad hoc committee. We've passed an economic stimulus bill, the first one, and the second one is in the works as well. Legislations are being introduced on a daily basis, such as the codification of the social investment program, and so on and so forth. And we'll go into all those details later. Of course, the infectious disease control bill, which perhaps is probably the most famous bill in Nigeria today for whatever reason, is also there in the works. And these are all measures that we have taken in the House to confront a monster, a very tiny monster, but a monster nonetheless, that has the potential of destroying us as people and destroying our country. And it's a fight that we all must be a part of. It's not just for government; it's for every one of us. And that's why I'm happy to be on this panel to discuss the issues that may arise. This is introductory. You said just 2 minutes, and as a law-abiding citizen, I think I've kept within the 2 minutes. Do I have more time? No, I don't. I didn't think so. All right, so there you have it.
There'll be a lot of time for you to come back, and I know that having spoken to you earlier, that there's a lot you have to share. So I'm going to ask, thank you so much for that intro, and I'm going to ask Major General Irabo to please give us his overview.
Well, thank you very much, Bolanle, and let me equally appreciate the convener, Professor Ajayi, and the rest of the team. I equally like to appreciate my co-panelists, especially the Right Honorable Speaker and the rest of the team. Well, the topic, biosecurity emergencies, it's a topic, in my view, that every one of us in the military, we are not only used to them, but equally to help to tell the public that it is, an area that we have taken very seriously. You may know that the military is the last line of defense for every nation. And so that's why it's well aptly captured in the Constitution of the Federal Republic in section 317, subsection 2A to D, wherein that the military is there to protect the territorial integrity of our dear country. But equally states that the military could be involved in aid of civil authority. And so when we talk about biosecurity as well as emergencies, the responsibility of the military is captured in that sense under that section of the Constitution. And so as we have it currently with COVID and of course other emergencies that we've had, including some of the insecurities that we've had across the country, the military has been involved, and deeply so. I know that for some reasons, given our historical past, that is the armed forces of Nigeria have been involved at some time in political leadership of the country, some of the narratives have been well misplaced within the society. And that, of course, has also added some form of challenge into bringing into perspective some of the value-added services that the military has been contributing to the development of our dear nation. I believe that this opportunity is well appreciated. And as we go into the discussion, of course, areas of interventions that I've had to present will be made known to the public. Once again, let me thank you very much, moderator, along with the convener and my co-panelists for this great opportunity to speak to the topic and to also discuss on this panel. Thank you very much.
Thank you, General, for that very brief but thorough introduction. I'm going to ask all the panelists to please increase the volume. People are finding it difficult to hear us. So please kindly turn up the volume on your sets. Thank you. Right, so I'm going to ask Professor Abdulrazak Habib to please give us his overview. I think Professor Abayomi is still on the way, but I'll ask Professor Abdulrazak to please step in, Habib to please give us his overview. Thank you so much.
Yeah, thank you very much, Bolanle and Professor Kanyin, for giving me the opportunity to come and discuss aspects of infectious diseases insofar as it concerns COVID-19 and also the draft infectious disease bill. As you are aware, infectious diseases, especially the emerging and re-emerging ones, constitute a major bio threat to humanity. And as we've seen with COVID, over the past 5 to 6 months, it has threatened the world, it has threatened lives, it has compromised liberties, it has also compromised livelihoods of people throughout the world, especially in the developing world, where in addition to the hazard of COVID, we also have already weak health systems, which threatens to lead to the collapse of whole economies and the healthcare industry. In the coming minutes to hours, we'll be discussing the impact of COVID in Nigeria, especially from my own perspective as from Kano State. I serve as co-chairman, not chairman, of the Kano State Task Force under the chairmanship of His Excellency, the Deputy Governor, Kano State, Dr. Nasru Yusuf Gawuna, and the overall leadership and oversight of the task force activities rests on His Excellency, the Executive Governor for Kano State, Dr. Abdullahi Umar Ganduje. And as you may know, some of us within the task force suffered and had first-hand experience of COVID-19 in the course of our work. Some of these experiences, I believe, will come up through the course of the discussion. So biosecurity is a major issue, and as a past president of a Nigerian Infectious Disease Society, I'm aware our society is putting together a memo towards the control of infectious disease bill, which perhaps also may come up in the course of discussion. Once again, thank you for giving me the opportunity to my thoughts on some of the aspects that may come up in the coming hour or two. Thank you very much.
Thank you so much, Professor Habib. Again, very thorough. And what I'll do now is I'll ask the last, but not the least panelist, Professor Abayomi, to give us a quick overview of the topic tonight. Thank you.
Thank you, Bolanle. Can you hear me?
Yes, we can. Yes.
So greetings to all the other distinguished members of the panel. It's a pleasure to be on this discourse. I'm speaking from Lagos, and unfortunately I'm in a car, so I hope you'll excuse the ambience of where I'm sitting. So I just wanted to say that biosecurity means different things to different people. So for example, a lawyer or a member of the House of Assembly will be looking at laws and policies and regulations that define what biosecurity is for a community or state or a region. A doctor or a laboratory scientist will look at biosecurity from a perspective of what emerging infectious diseases do to the public, to human beings. A scientist will look at biosecurity in terms of the ability to contain his pathogens within a laboratory and not allow them to escape, and also not allow those pathogens to infect himself or his colleagues within the laboratory. A scientist would also be looking at the biosecurity perspective from the biotechnology developments. So we now have the additional capacity to genetically modify life in any form, whether it's a pathogen or a plant or even human beings. And so, you know, the consequence of altering the genetic makeup of any living organism is of biosecurity concern. And then, you know, the environmentalist will be looking at biosecurity, or the agriculturist will be looking at biosecurity in terms of, you know, simple things like, you know, what plants and the ecosystem do to the environment in which we're living. For example, desert encroachment, use of genetically modified plants, the effect of different chemicals on the ecosystem. And then when we try and put all this together, then we get what we call the integrated biosecurity system. And that sits on the platform of what we call the One Health paradigm, which is a World Health Organization perspective. It's a global perspective, and it now looks at the integrated approach. And when we talk about biosecurity, if we look at all what I've just described, then you're looking at how do you maintain the integrity of your biosphere. And your biosphere is that environment in which we as human beings, the pinnacle of existence, how do we survive within that biosphere that is so important for us as human beings? So the One Health paradigm sits on three legs. It's the environmental health, the agricultural health, and then we as the pinnacle, the human health. So if you are only as healthy as the environment in which you live in and as the food in which you consume. So when you talk about a healthy human being, you have to look at it in the context of the environment in which he exists. If you're breathing in polluted air, if you're drinking contaminated water, if you're eating food that's full of pesticides, or you're destroying your environment, creating the opportunity for emerging infectious diseases to emerge, then you're disrupting the biosphere, and that's when we talk about Mother Nature hitting back. So I like to look at biosecurity from the integrated perspective, and that's the policy that we're driving in Lagos State. We call it the One Health paradigm, and we've developed some reviews of our laws and developed some policies that will help us to shape that integrated approach in Lagos State. So I think I'll stop there as an introduction. Thank you.
Thank you very much. That was very integrated. I learned a lot looking at the different angles to that. So I'm going to go straight into this question segment. Right Honorable Gbajabiamila, I'll come back to you. It is clear that COVID-19 has brought major economic disruption to Nigeria with the closure of many businesses. I can tell you for a fact that we have observed there being an epidemic. It would also appear that the lack of effective social security seems to have made our problems worse in Nigeria. So the question then is, what will our legislature do about social security in the 2020 Appropriation Act? And are there plans to compensate businesses and individuals? Because I heard you say earlier that you were doing quite a bit in terms of the economic stimulus bill and social investment programs. So I don't know if you can throw more light on that, because people are really hurting and they would like to know what the laws are regarding taking care of businesses and people in this time. Thank you.
Yeah, thank you again, Bolande, for the question. Of course, lives have been disrupted. Like I said earlier in the intro, we've never seen this before. And it is our hope that we will never see this again. You talked about social security. What we have that is akin to social security in Nigeria today, social security is something called from the United States and from Western countries. What we have is what we call the social investment program. Right now, hitherto now, before now, what you had was the social investment program, that is the Empower, the Money Trader, the cash transfer, the school feeding program, and a wide variety of other programs. But unfortunately, those have not been codified. So basically, most of this is left to the whims and caprices of whoever is in charge to determine who gets what. So it's basically something that is not statutory. It's not codified. It's budgeted for, but again, it depends on who's handling it at the point in time. What the House is doing now, and I believe in the next couple of weeks, we will be introducing a robust codification and expansion of the social investment programs in Nigeria that will take care of the poor and vulnerable. And that's the standard. It's for the poor and the vulnerable. It will codify who is poor and who is vulnerable. It will define who is poor and who is vulnerable. The geographical spread will be determined by law. And so the House of Representatives has been very proactive in this. And like I said, in the next couple of weeks, we should have something on the floor of the House that will be debated and hopefully passed on to the Senate for ratification, so to speak. We have passed the emergency economic stimulus bill from the onset in March when this broke. It's passed the House. We went through the first, second, and third reading the same day, even though many people feel that's an anomaly. But we went through because of the urgency of now, we went through the first, second, and third reading of the economic stimulus bill, which it was three-pronged. One, it allowed companies to basically write off 50% of their taxes. And the whole idea was for people to retain their employees. And if you did that between now and December, we'll write off 30 or 50% of your taxes. The second part of it was to give a moratorium to mortgages and loans. And the third of it was basically to drop duties and charges for all medical bills. Unfortunately, for now, it's still lying in the Senate. We passed it on from the House, it's lying in the Senate. From the Senate, it'll go back and go to the President. The second economic stimulus bill, which is in the works right now affects a lot more people, the middle class, so to speak. And that itself should be on the table in the next couple of weeks on the floor of the House. So there's a lot that's going on in terms of social security, which is what your question relates to. And hopefully, there are lots of moving parts. You cannot fix this in one day. So as we continue, I said we've set up a post-COVID team in the House of Representatives. As we continue, we'll begin to churn out legislation, which is what we our primary responsibility, to deal with the disruption, so to speak, of our daily lives.
Down to us, the man on the street, the middle class, like you rightly said. So I am looking forward to this second stimulus bill that you're talking about, and hopefully it will trickle down to a lot of us. But we'll come back to that later. So I'm going to ask Major General Irabo the next question. General Irabo, it is clear, as the speaker has spoken, that the economic disruption to Nigeria is clear to everybody. There's no denying that. But I often wonder that how would the military stem a potential breakdown of law and order if we had had the level of mass casualties witnessed in other parts of the world? Because we saw what happened in Europe and what is happening in America. If that had happened in Nigeria, are we prepared for emergencies like that? I'm aware of the fact that you've done a lot, and you were the head of the Nigerian Army Anti-Boko Haram Operation Commander. So what measures are in place to ensure that if, God forbid, are we prepared for such? Thank you, sir.
All right. Thank you very much, Bolanle. First is to say that thankfully, we're not at a stage where there is a massive breakdown of law and order in Nigeria, as it were. However, having said that, we as a military, in conjunction with other security agencies, were well prepared to handle such issues. But you see, we believe that being proactive is more important than having to wait until there is total breakdown of law and order before you act. And so to that extent, we have, and joined the fight, especially in the current pandemic, coronavirus pandemic, by deploying some of our medical personnel after training, deploying them to various states of the country, in fact, across the 6 geopolitical zones and the FCT. We've equally prepared some of our medical facilities, hospitals and medical centers, prepare them in such a manner to support the civil authority, that is the civil medical establishment and the management of the pandemic. But beyond the health-related pandemics, such as the coronavirus, other emergencies, we are constantly reviewing our TTPs, that is our techniques, tactics, and procedures, as well as our policies to, take into consideration the dynamics of the emerging world. We believe that at every point in time, we must review some of our training engagements to be able to incorporate what needs to be incorporated, because, like I said earlier, the military, of course, is the last line of defense, And that means that we cover all the broad range of life and its existence. And health is one of that. So we, as a military, we are prepared for any emergency that will come. But of course, you may also know that we can only prepare as much as the standards that is available in the country. We cannot go beyond what the society provides and, of course, what the government provides. But I believe that our preparedness can, fit into managing whatever emergencies that may come to us as a nation. So, in the meantime, perhaps I should stop so far, hoping that as we proceed on this engagement, more details as to what have been our engagement, not just only for the health-related emergencies, but equally security-related emergencies. With the details, of course, we'll be ready to provide in this discourse. Thank you.
Thank you so much, General. We'll look forward to that. Professor Habib. Professor Habib, it's interesting because he's a COVID survivor, and he actually went through a rough patch with that. So we're glad that you're with us. Can you hear me? Right. So given your experience as a COVID survivor, it's important that you share what you went through, because a lot of people still believe that COVID-19 is some form of hoax and that it really doesn't exist. I still had a friend visit yesterday and said, this is a joke, it's not real, I've not seen anybody die. So what I'd like for you to do for us is, I believe the public would like to hear about your experiences from symptoms to hospitalization and recovery. Thank you.
Thank you for that question. As I said, I work both as a hospital consultant in infectious diseases and also as co-chair for the task force here in Kano State. Sometimes around the late March, I think I got infected, and the symptoms started manifesting around 9th of April, mostly with fever and shortness of breath and cough. Initially, I thought it's a complicated malaria, and I started taking anti-malarial medications. I later added antibiotics, but by the 7th day, its shortness of breath was becoming prominent and cough. And I had already tested myself for COVID 3 days before, and the result, lo and behold, turned out to be positive. And I was called in one night to be informed of a positive result around 11-12 midnight. And the very next morning, I proceeded to the isolation center. We were the ones that equipped the isolation center, and we took His Excellency, the governor, to see for himself the planning and the preparation that went into the isolation center a week or two before, not knowing that I'll be among the first ones to somehow benefit from what was placed in the center. And within the center, on the day I went, I was fainting. I couldn't hold myself sitting or standing. I had to lie down, and eventually I went into shock. I needed several liters of IV fluid, and I needed also oxygen by tubes, by nasal prongs, because my oxygenation was low. For 4 days, I was without trousers, without significant dress, and the fever continued to rage to over 40 degrees, and then it came to 39. I received so many medications, around 9 medications. And when I started recovering, I also went into the things like steam inhalation with the black seed, with clove oil, and took ginger tea, among other things. The overall, I recovered around the 10th, 14th day. And at that time, I was getting worried, really, because I also developed low potassium in my blood, and the drugs I was receiving, azithromycin, and to some extent also hydroxychloroquine, are known to cause abnormalities in the beatings of the heart. And lo and behold, when I closed both my ears and I also lied down on my left-hand side, I felt the heart was not beating right. I had to alert the team and my colleagues to somehow change the type of fluid I was being given to those that contain potassium. I also was getting worried about blood clots. So then we had to put blood thinners. I was injecting myself with blood thinners, Clexane in this case. And then later, I started getting worried that as if my chest was not expanding well, and we didn't have spirometer to expand the lungs. So I had to use a bottle of water, this bottled water, remove the cap, punctured it from below, and I was blowing it as a form of chest physiotherapy to try to improve the functioning in my chest. By the time I was about 2 weeks, I had started sitting, because initially even the Muslim prayer, I couldn't do it sitting. I had to do it lying. But later, with improvement, started sitting, and then subsequently, much later, started standing. One thing I was really scared of while I was in the hospital is the issue of whether I will need ventilator, whether I need to be intubated. That really scared me, and I had to alert colleagues that we should have a team deployable within very few minutes if I needed intubation. And I think this is an area where the whole country needed to look closely. Many of the patients who die with COVID usually die because ventilation is either delayed or the expertise and skill is lacking. So whenever I hear anyone denying that COVID exists, I feel so bad about it. I feel if I were near him, I'll give him a blow, actually, because most people feel that now that, or when I recovered, many people felt really there is high likelihood I was not going to make it. The survival in my situation with the levels of oxygen saturation I had they could have been very low. And a colleague of mine who also suffered the same stormy course wrote to me an SMS as I was recovering that we should thank God at this second opportunity at life. You know, that I felt surely we were really near the age. We had a near-death experience. And while I was there, yes, there were unfortunate cases wherein eventually they died. So in a nutshell, this was my time there. And when I recovered, I had the Quran with me, the Holy Book, and I had this interesting book by William McNeill on plagues and peoples. It echoes with the biosecurity theme of this meeting. In that book, he described how plague destroyed 24 million people in Europe in the 14th century, how the devastation of smallpox led to the Spanish conquering both North and South America, how yellow fever was transported across the oceans to the New World in North and South America, and how it has continued to plague us every now and then. So there is a considerable reality that these diseases can cause major biosecurity problems. If 1/3 of a country's population could be decimated within few weeks or few months, I think that is a figure that no one should ignore. And even for the COVID, the initial modeling that we're having suggested the cumulative mortality for Nigeria could be as high as 225,000 people by February 2021. That is a large figure. So we need to have to look at this closely. Infections and fevers are major threats to mankind and humanity, and they've changed human history and civilization throughout time. So we shouldn't play with this, really. Thank you.
Wow. I'm so glad you're with us. I mean, that's touch and go, really, COVID. A lot of us, like I said, I'm glad you're here simply because we wanted people to hear about your experience, that it is real. We're thankful that you're here with us. So I'm going to move on to Professor Akin Abayomi. Professor, I'm going to ask, how real is the threat of the weaponization of pathogen of high consequence, such as COVID-19? And what are we doing to protect our borders against this?
Well, you know, as I was defining what biosecurity means to different people, I hesitated to talk about bioterrorism. So to security agents, biosecurity is the understanding of how biological agents can be used in the art of warfare, or in fact, how you can protect yourself, which is counterterrorism, how you can use certain strategies to protect yourself from an offensive attack. So the attributes of an agent that are useful for this kind of situation are usually things that are highly contagious, for which we don't have any defined or known treatment, for which there is no vaccine, which are easily spread, cause significant morbidity and mortality. In other words, make people sick, and can cause a high rate of fatality. So these are the ideal characteristics of such an agent, if it were to be used under those kinds of circumstances. And this is why we have such powerful global treaties like the Biological Weapons Convention, because it's considered to be unacceptable, unethical, and immoral to use either biological agents or chemicals or toxins. So the Biological Weapons and Toxins Conventions actually prohibit the use of such agents in the mix of armed conflict. And most countries are signatories to these international conventions. Nigeria is certainly a signatory. But you know, in life, you never know who has an operation that is potentially thinking of using this kind of form of aggression. And therefore, many international superpowers all have a biological countermeasure operation, because you never know when you will be attacked. You never know what unscrupulous group of people may decide to utilize such an agent, even though they're banned. Usually would consider non-state actors as a risk, because they don't normally operate under the norms or the acceptable tenets of global treaties or harmonization. So the risk is real. The security agencies in each country are designed, or should be designed, to detect where this potential threat exists. Our laws should prohibit it strongly. We are revising our laws in Lagos State and developing biosecurity policies and a biosecurity roadmap that make it such an event or such an opportunity extremely punishable under the arms of the law. So it's not an impossible scenario, and you know, it can come in many disguises, even as low as you know, putting a little bit of poison in certain biological agents as a form of aggression is a form of bioterrorism.
Oh, thank you so much. So it is real, and like Professor just said, Mr. Gbajabiamila, Right Honorable Gbajabiamila, I would imagine that also in the course of us, you putting together the new bill, we're going to be looking at things like bioterrorism as being part of the legislation. Honorable Gbajabiamila.
Yes.
Yes, right.
You're talking about the
laws, yes. The new laws that we're looking at, that we will be looking at things like that going forward. So, can you hear me?
Sure.
I don't think you can hear me.
I can hear you.
Okay, I said that I'm sure that all right, I said that I'm sure the new legislation will take into consideration things like bioterrorism. And in addition to that, I was going to ask about the state of decay of our healthcare system in Nigeria, and also hoping that I'm going to ask you, how do we ensure that our public health laws going forward include funding for healthcare infrastructure, biomedical and policy research, training of medical professionals, and a general focus on the health and wellness of our citizens? Because a lot of times it seems like it's shifted from federal to state and local governments, and we're wondering who is responsible for our health infrastructure. I mean, we've seen what happened with COVID, how people started donating, and we had to all scramble around to make makeshift isolation centers. So I don't know what your plans are for us in terms of this in legislation. Excuse me. Thank you. Am I clear?
Okay, thank you, Bolali. I'm going to try and unbundle the questions that you've asked, but let me start by saying there's a takeaway from this. In every bad experience, the most important thing is to learn from it. And I think we've all agreed that we're all on the same page that our infrastructure in terms of health requires priority and a lot of work. And that's why in the 2020 amendment to the budget, which came to the House just a couple of days ago, we're focusing primarily on our infrastructure, health infrastructure. And so there would be adequate funding, hopefully, and a lot of research will go into this. Now, let's talk about the
new act, the infectious disease,
the new bill that
right.
The infectious disease control bill, which you touched upon, which is gained a lot of attention in the last couple of weeks. Now, we agreed that, right, the Quarantine Act we operate right now cannot get us anywhere.
Nope.
Let's not even begin to debate that. An act that was passed in 1926 and does not even begin in your intro, in your preamble, you talked about the airports not being covered. That's exactly what it is. The airports in Nigeria are not even covered by that Quarantine Act because people were not flying at the time. So if you want to deal with anything in terms of ingress and egress as far as air travel is concerned and infectious diseases, you cannot even use the Quarantine Act. The Quarantine Act talks about sea vessels and the rest of it and land borders.
Right.
So we're already out of sync there. The Quarantine Act, maximum fine between 200 and 500 naira. Now there are three broad categories of people who have commented on the act and are probably and are opposed to it. You have the people who are genuinely concerned, and I understand those concerns. You have those who are more interested in opposing the bill for political reasons. That's understandable too. And then you also have those who their fears are born, their concerns are born out of fear. What does this new bill do? What exactly does it do? Some people have talked about timing, that why must you bring a bill at this point in time? You just asked me that question now, that what are we doing? Should I have sat here and pulled my arms and said, well, nothing yet until the virus goes away before we begin to look into new laws? No. In fact, there cannot be a better time than when something is happening and you see the lapses for you to be proactive and moving speedily. Correct. And with dispatch. That's the best time to do it. In another country, you can even be accused of negligence. For not, this is a disease, this is a virus, we don't even know when it's going to go away, if it's going to go away. So I think for us, the urgency of now was paramount in our minds when we introduced this bill. And so the timing, and then they talked about speed, first, second, third reading on the same day. That's not the first time. It's not the second time. It's not going to be the last time. When something is urgent, when something is required as of yesterday, we've done that. first, second, third reading. In fact, the economic stimulus bill, which I talked to you about, which we proposed sometime in sometime in March, it was the first, second, and third readings we did on the same day. Now, Lagos State has done so well. Lagos State has done so well in confronting this virus. And from my understanding, and excuse me if I'm wrong, I believe the infections that they a bill to tackle this was passed. But be that as it may, what are the lapses in the Quarantine Act?
Yeah.
There's something that's been going on. There's something that's been going on in Nigeria since this thing started. People are escaping from isolation centers. It happened yesterday in Abia State. It happened in Gombe State. We all saw the people on the streets were escaping from isolation centers. Now, one of the worries of people who are concerned about this bill is that why would you arrest people without a warrant? That's the first thing I hear, and I'm like, really? So I've been diagnosed with COVID-19. I'm in an isolation center. I don't like it, and I escape. There's a policeman who's there guarding the isolation center. So we are prepared to hamstrung the policeman. He can watch me escape, but he cannot arrest me. He has to go to court to get a warrant of arrest. And God help us if it's a Saturday or a Sunday, he has to wait until Monday. By which time, of course, I've infected several other people. Those are part of the lapses. So it's already, a warrant without arrest is already part of our laws. It's in the ACJA. It's already there. We're not doing anything new. They've talked about isolation centers and why would the DG, NCDC have the right to declare a place an isolation center? Again, that's nothing new in our laws. Our laws are very clear. The Prisons Act, the CG of prisons has the right to declare a place a holding center in the event of an infectious disease. Mm-hmm. So that's already there. They talked about mandatory vaccines, and I understand the fears, and I probably would be concerned myself. But hey, we all applauded the Child Rights Act. Guess what? There's mandatory vaccines in the Child Rights Act. Indeed, if you do not vaccinate your child as a parent or as a guardian, you're liable to, I think it's 6 months imprisonment. It's in our laws. It's in the Child Rights Act that we applauded. So I think, you see, what brought about this worries, and which I understand perfectly, is again the conspiracy theory. So we have as an institution, we send this to public hearing, and everybody's talking about their individual rights. But nobody talks about Section 45 of our Constitution, which says that your individual rights, in the event of public health or public security, your individual right must give way to collective rights. You see, where your right stops is where mine begins. If there's an overriding public interest, then you don't talk about individual rights. It's embedded, it's right there in black and white in our Section 45 of the Constitution. But where we are with this bill right now is that it's gone to public hearing. We've invited well over, and I can assure you that whatever comes out of that public hearing, whatever comes out of that public hearing is what we will pass. It's not going to be, it's obviously not going to come back the way it's gone in, because I can understand. There'll be a lot of tweaking here and there, so that everybody will be happy, everybody will say, but to do nothing in the face of this kind of danger, yes. I think it would be irresponsible on the part of any legislator to sit down, arms akimbo, and do nothing. Again, when I was talking about individual rights, we're all aware of the Patriot Act in America, anti-terrorism laws in UK, where they had to infringe on individual rights for the interest of the public good. So these are issues surrounding the present bill. Right now, the DGNCDC doesn't even have its powers defined. We can see what's going on in Kogi State now. There's a tussle between NCDC and Kogi State and the state government. The NCDC has come out with a directive Don't use rapid tests. Kogi State or any state, no, we're using rapid tests. We don't care about what you say. Why is the state able to do that? Because there are no clearly defined parameters and powers or empowerment of NCDC. So again, like I said, we will look at these issues. We'll consider them, and I believe that at the end of the day, the outcome of the public hearing will be satisfactory to everybody.
Thank you very much, Honorable Gbajabiamila, and I totally agree.
You want to talk about plagiarism?
Yeah, how did you know what I was going to say?
Oh, well.
The real issue was that people were talking about plagiarism and the fact that it didn't really take into consideration our socio-cultural issues. It just lifted it literally and dumped it in Nigeria. So fortunately, I have Professor Habib, who lived and worked in Singapore University for 3 years. And he has some views on the bill as well. But like you said, yes.
Yeah, let me just very quickly address the issue of plagiarism. We've rehashed this and talked about it, but there are some naysayers out there that don't want to listen to that. Now, plagiarism by law, there's no such thing when it comes to legal drafting. Let me make that abundantly clear. There's no such thing. It's not covered under Copyright Act. It's actually acceptable and it's international best practices. If something works in a particular jurisdiction, and it worked in Singapore, even though they may be tweaking it, but if something works, it's almost negligent on your part not to adopt it to suit your purpose. We have adapted it to suit Nigerian purpose, and there are many adaptations, but there's so many laws, Child Rights Act, the Trafficking in Persons Prohibition Act, even our criminal code and some of our evidence, our laws of evidence are lifted from foreign jurisdictions because they work in Nigeria. So that's what we've done, and infrastructure concession bill, and there's so many of them like that. You don't reinvent the wheel. If it doesn't break, you don't fix it. We have the Magnitsky Act in America that's adopted by UK and other jurisdictions. So I just wanted to put that out there. To make it clear that this is an acceptable norm. The UN sometimes even draft laws for different countries and say, put this in your law.
All right.
Of course, you will tweak it to suit your local circumstances. And that's it. And we have done that in this law. And we'll further tweak it if that tweaking is not satisfactory.
Right. Thank you so much. But I really have to jump in at this point because I'm going to come back because some questions were not answered that I wanted you to address in relation to our healthcare system. Apologies to all the panelists, but Professor Abayami has to go again. Today is Lagos State's first year, the present administration's first year in government. So he has to leave for something rather urgently. So I'm going to ask him the last question. Prior to the advent of Ebola, biolabs were not part of our public health system. But today, the BSL, the Biosecurity Lab levels 2 and 3 laboratory is the only one in West Africa, and maybe the only one on the continent. Why did it take so long to establish one, considering the fact that these types of diseases are prevalent in these parts of the world? And has this played any significant role in the COVID-19 pandemic? I just want you to address that because a lot of people are not even aware that we have biolabs in Nigeria. So I don't know if you could answer that.
Yeah, thank you very much, Bolanle. That's a really charged question, and I'm not sure how to answer that without causing problems. But, America has over 3,500 biosafety level 3 labs, and now labs come in 4 levels. There's 1, 2, 3, and 4. Most labs that you are familiar with are in the 1 category, where you can handle simple pathogens like a sore throat or a urinary tract infection or ordinary pus from a wound. Then 2, you start to deal with things like HIV and tuberculosis, a little bit more dangerous. And then 3 requires a very sophisticated level of biocontainment with negative pressure, all kinds of SOPs and mechanical ventilation systems that protect both the people working inside that lab and the people outside of the lab. So in a BSL 3 lab or biosafety level 3 lab, you can start to manipulate or diagnose very dangerous pathogens like Ebola, like Corona, like Lassa fever, like yellow fever. Pathogens that we call pathogens of high consequence. In other words, if they escape, they can cause severe problems. If people are contaminated by those viruses, it can cause death. And then you have the last level, which is the BSL-4 level, which there's only one in Africa. It's in Johannesburg in South Africa, but there are many all over the developed world. And they're usually in military facilities or aligned to military facilities. And in these labs, you keep, extremely dangerous pathogens that, most of us can't even dare to think about, or even pathogens that have been eradicated and you're just keeping a small stock of them. The people that work inside these laboratories are very highly trained biosecurity scientists. The equipment is very, very expensive and elaborate and is very hard to maintain. So when you have an outbreak, the whole of the equatorial belt of Africa is where all these very dangerous pathogens live to start with. So you would imagine that along the equatorial belt of Africa, you would have thousands of these biosafety labs at level 3 or even level 4. But that's not the way the cookie crumbles. And there are many reasons why we don't have these sophisticated BSL laboratories in this environment. It's a very contentious subject. But suffice to say, we learned our lesson from the Ebola outbreak. We realized that we were severely handicapped by the lack of the ability to properly diagnose Ebola in the correct environment. Many of our scientists, doctors, and pathologists were infected by Ebola because we didn't have the right environment in which to manipulate or to diagnose these pathogens, and many of our colleagues died during the Ebola outbreak, both in Nigeria and in Sierra Leone, Liberia, and Guinea. So Lagos took that experience very seriously, and since 2015, we decided that we would be a place where we could develop and build a biosafety level 3 and a biobank hybrid. And we've been working very diligently to get one of those. And in 2018, we commissioned ours, and we started to prepare specially trained scientists and pathologists and biomedical engineers to run this facility. It's one of, since Ebola, there are about 2 now in West Africa, but ours is a special design because it's a hybrid. It has negative pressure to protect very sophisticated equipment. It's totally solar paneled. It runs off the grid, but it has 4 levels of energy. And we've been training staff in this facility for the last 3 years, and they're highly trained personnel, where you use this laboratory to make the diagnosis of Ebola or COVID-19. And so it put us in a very advanced position in terms of being able to counteract this outbreak right from the outset. I mean, we saw the outbreak coming. We saw it creeping across Southeast Asia. We saw it enter the Middle East. We saw it enter Europe. And we launched our incident command system in as far back as early February, a month before the first index case. And we started to ramp up our preparation very early on. I mean, this has been going on for years, but we could see it coming. And there was no reason why it wasn't going to come to Nigeria, since it's a highly contagious airborne or droplet-borne pathogen. So we were expecting it. And when it came, we were prepared to, as prepared as you can be in a third world environment. So I think I've tried to answer your question without getting too controversial. You would need a closed door session to really expand on this kind of issue. So, and I'll use this opportunity to say goodbye. As you pointed out, I have to be at another urgent function. So thank you for having me on the show. And I look forward to looking at the questions and the summary of this webinar. Goodbye to my fellow panelists.
Thank you so much, because I know you really squeezed time out for this. Thank you so much. All right, so I'm going to go back to Major General Irabo. As I was saying earlier, as I was saying earlier, it seems like the military in Nigeria does a lot more than we are aware of. And especially your fight, the Boko Haram issues, COVID-19, we just don't seem to hear a lot about what you do. So I don't know if you can enlighten us on a lot of the operations, both security and biosecurity issues that you've had to deal with in the past couple of years. You know.
All right, thank you very much, Bolanle. There are two parts. The first, of course, will be the physical security related operations that we've been conducting. And then, of course, I'll take on the biosecurity content. On the physical security, of course, I believe that everyone in Nigeria are well aware of our operations against Boko Haram terrorists in the Northeast. And of course, the banditry operations that we conduct in the Northwest, and of course, some other places across Nigeria. The interesting thing is that, yes, there are a lot of expectations from Nigerians as to what we do, because physical security, as you know, is very important for other, aspects of our lives, socioeconomic life to exist. And so the apprehension you find, on the part of a good number of Nigerians in this regard is well appreciated. But I must say that the military, of course, in conjunction with other security agencies, have had to put in their bid to ensure that life returns to normal, not just in the northeast of Nigeria, but across every segment of the country. So I know that you may have been aware of the Niger Data Operation Data Safe, which of course addresses some of the challenges I've had with the oil and gas industry. You equally know, some of the security-related issues in North Central. Now, by and large, these operations have been going on, well, and we believe that in no distant future, the end of these security challenges will be very visible. Now, on the COVID-related or health-related interventions with respect to COVID-19 pandemic, the Armed Forces of Nigeria, there is a committee, interestingly, which I chair, that addresses all issues that have to do with containing the pandemic, the spread of the pandemic, not just the barracks, but also giving support to the Presidential Task Force on COVID-19. And the barracks, we ensure that we carry out, sensitization, enlightenment of not just the personnel, but equally their families. You know that we live communal lives within the barracks, and so one can only imagine if there's an outbreak, if there's an outbreak of COVID, in 19 in any of our barracks. So to that extent, we're able to ensure that we keep to the NCDC medical protocols and guidelines, and ensuring that not only are our personnel sensitized, but equally take steps to ensure that the surveillance on the virus itself is well kept in check. We also ensure that our various barracks are disinfected. Then, of course, our colleagues who have traveled to various parts of the country for one reason or the other, training or operations related, each time they return, we ensure that they are properly quarantined. We have locations where we have prepared for them to be quarantined. We equally encourage self-isolation in some cases. And then we've also prepared some of our hospitals to take on some of the cases, for the treatment of the cases. We have trained, with support from NCDC and Ministry of Health. We've trained some of our personnel to handle such cases. And I did mention this earlier in the discussion. But beyond that, we believe that, yes, the military being the last line of defense, we do not need to wait until we are called in. That's the reason why we have had to interact with the Presidential Task Force on COVID-19. There is an interface that we usually have, and they have called us to provide some form of support, including airlift of many of the personnel that are involved with the Presidential Task Force on COVID-19, providing not just air transport, but equally a movement of the logistics requirement to one part of the country or the other. So these and very many others that we undertake. But I know that you may not have heard of them because, of course, I believe that under a democratic dispensation, it is better for you to see what you will do rather than you hearing what we do. I think that for those who should know, they are well aware of our value-added services, and I think that we are also gearing up to ensure that if the problem as it is currently overwhelms the civil establishment, then of course we have in place measures that will enable us to ensure that we plug in whatever loopholes that may exist. And this is precisely what it is currently. I think that perhaps it's a good opportunity to reassure the public that yes, our health system might be very weak and poor as it is current, as we may see, but of course it has not gone to the level where the problem will overwhelm us. I believe that societies evolve, the situation generally is dynamic, and we are learning lessons to ensure that for us in the military, we're able to ensure that we re-strategize, building up our infrastructure such that if our services are required in greater detail beyond what we are currently providing, we're able to meet the demands. Thank you very much.
It's unbelievable. You're doing a lot, and we're really glad. Thank you very much, General. I mean, you're doing a lot, and I'm glad that you were able to share that with us because a lot of us do not have a sense of how much work the military in Nigeria is taking on. Just as an addition to what Professor Abayomi had mentioned earlier, I'm sure that you're also training in the areas of bioterrorism.
Yes, you are very right. I think Professor Abayomi, was quite elaborate in talking about bioterrorism. Yes, we, of course, that, within the conventional setting, the chemical and biological warfare treaties, various treaties that have been enacted, Nigeria is a signatory to all. These are under, conventional settings. But currently, the threat environment, the threat scenario is such that it's asymmetric. And so even you find that there are individuals, terrorists, of course, and criminal-minded individuals who may want to, of course, take advantage of the use of these pathogens, ensuring that they cause mayhem across any part of the world, Nigeria in particular. This, of course, we have factored into our policy, and that's the reason why we have established a defense research laboratory, which, of course, undertake some of these issues. Of course, we are doing that in partnership with some of our key allies in this regard. And I think that what Professor Abayomi talked about earlier on, talking about the lab in Lagos, of course, it has military content, and I believe that at the auspicious time, of course, we have greater interaction with respect to it. But yes, we are very prepared, and we are looking into ensuring that should criminally minded individuals want to use bioterrorism incorporated into whatever they are doing to disrupt our security network, then of course we'll be able to act appropriately.
Thank you so much, General. Brilliant job. Thank you. I'd also like to ask the last question so that we can open it up to the audience. Professor Habib, just following up on what Honorable Gbajabiamila has said earlier about the bill. We had a conversation about you working in Singapore for about 3 years, and I suppose you have some contributions to make in relation to that.
Yeah, thank you very much, Bolale. Basically, as the Right Honorable Speaker mentioned, the dialogue is largely that of public good versus individual liberties and human rights. And oftentimes, in most circumstances, public good is given an edge over individual liberties. Although having said that, we also look at the basic medical ethics principles of first, doing no harm, second, doing good, and all the time respecting autonomy of the individuals and also doing justice. Having taken these principles into view, if you look at the Singaporean situation, clearly there are many positive sides to it. Firstly, they were able to eliminate malaria in as far back as 1982. Secondly, they have a Singapore tuberculosis elimination program, which I'm not aware of any other tropical country that has such an ambitious project to eliminate tuberculosis. These are hinged on notifications. Given it is an island city-state, they're able to improve notifications, improve reporting, improve recording, and at any given time, they know all the people, all the patients with any given disease. However, there are downsides also. You hear of rules where individual rights are not quite factored. Things like the Spitting Act, spitting or chewing gums, environmental aspects of the Infectious Disease Act easily could land someone in jail, and they seem to surpass common sense. Secondly, you have things like disclosures. For instance, a healthcare practitioner is empowered by law to go and disclose to a spouse that his partner has HIV infection, even without the consent of the partner. There are also situations where really the individual liberties and rights are not factored. As regards the infectious disease bill under consideration, the Nigerian Infectious Disease Society, its president, will be making a submission, but some of the aspects that we've noted are things like overlap with existing agencies, such as with NPHCDA, with NAFDAC, with NEMA, with NACA, among others. Secondly, we've also noted that definitions of dangerous infections have not been thoroughly made carefully. For instance, we have plague, yellow fever, SARS, and coronaviruses, but we have no mention of Lassa fever under dangerous infections. We have no mention of Ebola or other viral hemorrhagic fevers other than yellow fever in the whole document. It's largely based on infections, ancient infections that were on the original 1926 Quarantine Act. And in certain areas, I personally feel, rather than put absolute amounts of monies on such a bill for penalties, I think it's high time we start pegging it to say basic minimum wage, to say 10 times, 20 times the basic minimum wage, because the Naira is so volatile. It's not a stable currency, and you can't use other foreign currencies. And the bill should also factor the socio-cultural context. For instance, there are areas where you speak of postmortems and exhumations. I think it is important. However, there has to be the socio-cultural context looked into, and there should be public engagement. And then in certain places, I feel like the powers given to the DG should be robust, should be really far-reaching. However, there are areas where I think those powers seem to even surpass that of the Minister for Health. So I think overall it's a good development. We should dialogue on the bill as it is. We should try to modify it. We should factor sociocultural context to it, and also explore some of these observations that the current president, Nigerian Infectious Disease Society, will be submitting and presenting on behalf of the society in greater detail. Thank you.
Right, thank you so much, Prof. That was fantastic. I wonder if you and the honorable speaker will probably get together. We've done massive introductions here, so you can both get together. I'm sure Honorable Gbajabiamila would find a lot of your comments useful. As he said, this is now subject to public hearing. So this is brilliant. Thank you so much for your contributions. I wonder if it's time for us to go to the public and take some questions now. Right? Okay. So we'll take some questions from the public. I'll read out a couple. Can't seem to find any of the questions. Whilst I'm doing that, I'll ask Honorable Gbajabiamila one more time about one more question. You can answer it, and also I'll throw it to the three panelists. The index case came into the country through the Murtala Mohammed Airport. How prepared are we to track and trace entrance into Nigeria? Because we're aware that at some point, the airports are going to be opened up. Are we really prepared? And if we are, what measures are in place? Because I know for a fact that when I came back to Nigeria on the last flight before they closed the borders, not one person reached out to me after that. So I self-isolated just based on discipline. So are we really ready for this? So I'll ask Prof again. You can start off, and then Honorable Gbajabiamila, whilst I'll look at questions from the public.
Thank you, Bolanle. As I mentioned earlier, the task force in Kano has 10 pillars. One of these pillars is actually concerned with point of entry into Kano State. So we have teams deployed to all the major routes within Kano State, including the international airport in Kano, wherein we work with the Ports Health and other government agencies, the NCDC, the AFENET. We have a holding area within the airport. And also we've worked with the local government chairman. Between the state government, the task force, and the local governments, there are teams comprising of security agents as well as healthcare workers and environmental health officers stationed at the areas wherein entry into Kano is made. We also have worked with other major stakeholders such as the road traffic workers, NURT, stationed within motor parks to ensure anyone who comes in by land route, because we have a big international market here in Kano, wherein customers come from different parts of West and Central Africa. So we've been working with market unions and also the National Union for Road Traffic Union. There is a call center, there is a number easily they can call if there is anyone suspicious. We've been providing thermometers, anyone who is sick is reported. However, having said that, there is still need to strengthen all the entry points, especially the international airports, Lagos, Kano, and Port Harcourt, to ensure there is a foolproof the surveillance put in place, as well as also the land route and sea routes, especially for Lagos. In fact, I think the concern will be more for the land route and sea route. Like in Kano here, most people coming from Niger Republic, from Chad, potentially their aim is to go to Kano, and they go through bush path, among other things. And this is where also I think engaging community leaders like His Excellency, the governor here in Kano has done. He's brought all the 44 district heads. He has also brought the 5 MAs within Kano State. They've dialogued along with the local government chairman, and we are sure all these teams are working. But still there is need for the immigration and other agencies to also ensure the mainland borders, the sea routes, and also the international airport, especially by Ports Health and NCDC, are strengthened.
Thank you very much. Thank you. Would Honorable Gwaja, I'd like to say something about that, but there are loads of questions here. So would you just quickly say something? Are we ready to open up our seaports, and are we capable of handling cases that arise, tracking?
Well, I think Dr. Habib has covered the field.
Okay.
Safe to say that, we need to do a lot more education, educate our citizens for them to understand why they need to give correct information when they come into our borders. It's for their protection, it's for ours, it's for everybody's protection, and technology has to be deployed in this instance. We know that today a lot of people, quite a number of people, for good reason sometimes, give false information as to their contacts. So there has to be some kind of education, and that's why we cannot even self-isolate at this point in time, like it's done in UK and other countries, because you know that you can trace these people, you can go to where they say they're staying, and you'll find them there. But by and large, I believe Dr. Habib has covered the field, and I just think we need to educate our people more on the importance of giving correct information for the purposes of contact tracing.
Okay, thank you very much. Couple of questions now that I'm going to do this. Can the, I think he's left. Honorable Commissioner of Health explain the risk and role of community engagement in social mobilization and risk communication. Can we have, hello, can we have Professor Habib answer that, please?
About community engagement. What was it?
Community engagement in social mobilization. And just right after that, I'd like Honorable Gwajabiamila, there's a question for you also. I was excited to hear you commit to a 70% reduction in the perks earned by legislators as a way of ameliorating the critical economic crisis we're facing now, primarily due to the oil price shock and worsened by COVID. Please, when do we expect this to take effect? And what's the annualized saving that will be generated? And what will it be spent on? So maybe we'll take Professor Habib, and then we'll go right to Honorable Gwajabiamila.
Thank you very much. That is a very important question. And again, risk communication and mobilization, community engagement is one of our 10 pillars at the task force here in Kano. And the issue of engaging stakeholders is a very important one. There is nothing that can be achieved without the risk communication. And over the past 2-3 months, a series of such engagements have taken place with various stakeholders, as I mentioned, traditional rulers, local government chairmen, but also healthcare workers, the major societies, the consultants, nurses, medical laboratory scientists, that we've had dialogue with them, and also the major hospitals within the state. The Deputy Governor and His Excellency the Governor have worked and sat down with them, but equally also other traditional leadership, such as emirs, the district heads, as mentioned. Nothing can be achieved without them. And we've met with them, we've explained our strategies to them, as equally also the issue of businessmen, because as His Excellency the Governor always says, it's an issue of lives, it's an issue of liberty, it's an issue of livelihood. So equally also businessmen and market operators, market women and market unions, we have to sit round table to them. In addition to issues of prevention, use of face masks, social distancing and lockdowns, this has to be explained. I think there may be room for improvement by way of reaching out to the rural areas. Kano is such a big state, unlike Lagos. So we have rural areas. I think in the coming days to weeks, one would expect that as we expand, as we strengthen our risk communication, we take it out to the rest of the state. Similarly, I believe many other states are in the same situation. Rural areas, there is a lot of denial in there. Is an avenue where we should reach them. By way of activities we do, there have been so many radio programs, television programs, posters and IEC materials distributed. And I think we should also increase and use the use of exemplar and champions, people who have survived COVID, to come out as exemplars and survivors without any fear for stigma. For instance, people have asked me, don't I feel stigmatized? The stigma with COVID is different from stigma for HIV because it has nothing to do with behavioral aberration. Neither is it similar to the stigma with leprosy, where it's deformity and disability. So really it's an anxiety and fear that I could be infected. It's not so much a stigma. So people need to come out and share their stories and how they've survived it. And definitely communities, that we need to strengthen our engagements in rural areas. Thank you.
Thank you so much, Professor. I have another question for you, which I'll get back to, but I'd like Honorable Baja to answer the question that came in regarding amelioration and your salaries. 70% reduction in the perks. Is that something you would like to address, Honorable Sir?
Sure, it's come up, so I'll address it. I am not going to evade any question. But I can't resist, just to make a quick comment, Dr. Habib, I got a glimpse of your kids. They're really, really cute. Really, really cute kids. Having said that, let me move on to this question. What I was trying to distinguish or compare was salaries and allowances compared to perks. All right, the question was asked, and for me, I think we're looking the wrong way. If you're talking about cutting salaries and allowances, because if you do the math, salaries allowances in the National Assembly budget totals about 1%, if that, of the total budget of Nigeria. But if you look at the perks, the air travels, the vehicles, the vacations, the hotel stay, the tickets, if you put all those put all those things together, they make up to way more than the savings you get, way more than you get from looking at the salaries of public office holders, and that's what I was looking at. That's the real need there. You know, it's not so much the salaries, and that's my point. And I'll be more than happy for us to take a haircut in that regard and cut down the perks, and not just legislators. You know, and again, you know, people look at legislators, but legislators are in a very small number of public office holders. But I think it's important that, yes, legislators do understand the times we're in, and a lot of these perks will begin to streamline.
Okay, thank you so much, Honorable Baja. Archbishop Isaac Olawi asked Professor Habib. It's a very interesting question. He talks about you talk about black seeds and honey, ginger and garlic, and some other fruits that can build our immune system. Is there a way we can be allowed to treat COVID-19 with our own local herbs? Professor Habib. He's gone. All right. Professor Habib, did you hear that?
For a moment, yeah.
We're talking about local herbs, because you had mentioned taking black seeds, honey, ginger, and garlic to boost immune system. Is there a way we can be allowed to treat COVID-19 with our local herbs? That's the question.
Truly, I think we shouldn't use it as a sole standalone therapy for COVID-19. Actually, I used 9 different drugs: hydroxychloroquine, zinc, ascorbic acid, azithromycin, lopinavir, ritonavir, the ceftriaxone, and potassium, antimalarials, and clexane as a blood thinner, in addition to the fluids and also oxygen, making it about 11. So these ones are supplements, actually. I think at this stage, without robust evidence, scientific evidence, it's unwise to say we can depend solely on them. But you could pardon a fairly desperate man who thought he was under life-threatening condition if, in addition to the standard 11 drugs, he thought of adding 3 or 4 other herbal remedies. Yes, so they should be subjected to a rigorous scientific assessment before we could have a clear answer on this. Thank you.
Thank you very much. I think that I don't know if would like to have some closing remarks from our 3 participants so that we can close this session. We'll start with Honorable Gbaja. Thank you so much for your time. I know that it took a lot out of you to be here today with us, and we really appreciate it. If you have some closing remarks that you'd like to give, go ahead.
Well, thank you, Bolanle, and thank you to the other panelists. It's been a very enriching 2 hours, I think. Very enriching, very enlightening. Like I said, we're in a war, and we either want to confront this virus or we don't. It is a binary choice that we have. I want to thank the panelists, particularly Dr. Habib, for his insight into the Singaporean situation, and we're looking forward to his contributions, which he's mentioned a couple of things. We look forward to working with him on this bill, so the outcome will be desirable, will be pleasing to everybody. Yeah. Thank you very much.
Thank you so much, Honorable Gbaja. I'd like to go to the general. The general, I mean, a final question whilst you're taking your closing remarks is that, do you really think that the armed forces are not stretched with the insurgencies that they're taking on if we had to deploy additional forces, if the pandemic got bad? You think you're capable of handling both, sir? And thereafter, you can also do your closing remarks. And we really thank you for your time. Thank you so much.
Well, thank you. That question, of course, whether we are overstretched or not, we have no choice, because that's the calling for every military man. What's important is that we will, at any point in time, given what is required to bring normalcy to every given situation. We believe that the contributions we are making now will significantly boost the overall effort of the Presidential Task Force on COVID-19. But beyond that, perhaps as a parting word, is to say that for Nigerians, we must communicate a hope to our neighbors. And in doing so, we must ensure that we trust those who have been given responsibilities to undertake certain tasks. Our input must be to strengthen their input, as opposed to wanting to see nothing good in what they are doing. I believe that engagement by way of dialogue, enlightenment, public enlightenment, will help us to galvanize the needed strength to overcome whatever emergencies are in this current or in future emergencies. So on that note, let me once again appreciate this opportunity to be part of this webinar. And I'm hopeful that the outcome will be quite enriching and beneficial to everyone. Thank you so very much.
Thank you so much, General. It's been wonderful having you as part of this. Thank you. And last but not least, we'll ask Professor Habib to give his closing remarks.
Thank you very much. I thought perhaps I should just reiterate what someone mentioned nearly a century ago, that humanity has but three great enemies: fever, famine, and wars. But of all the three, by far the greatest, by far the most terrible is fever. Fever in the form of communicable disease, contagion, and infectious diseases should not be
Unfortunately, we can't. We're seeing the internet on Prof's side.
I
seems to
believe
slow down.
as a nation to see to the containment and while factoring all the three, and also livelihood. On that note, and thank you for giving me the opportunity to participate in this webinar session. Thank you.
Thank you so much. Thank you everyone for joining us. I think we've had a fantastic time listening to the panelists. I certainly have learned a lot. There will be another session next Friday. Please join us at 5 p.m. and the topic is State of the Future, Planning Beyond COVID-19. It is our hope that COVID-19 will come to an end soon and things will go back to some form of normalcy. Everybody's hoping to get back to work. So all materials for this particular webinar will be available, will be sent to all those who have registered via mail, and it'll also be on our YouTube page. So do not worry, you can get all the material relating to this webinar. Once again, I just want to say a huge thank you to Emmanuel Chapel Church, our Reverend, and the team for putting this together. I learned a lot, and I'm so honored to have met Major General Irabo. Incredible work you're doing, sir. On behalf of Nigerians, we want to thank you. Unbelievable. Thank you, sir. And our dear Mr. Femi Gbajabiamila, the Right Honorable, thank you so much for the work that you do. We hope that that economic stimulus that you mentioned will be seen very soon by all of us on this panel, because some of us are hurting. Thank you so much. And Prof, I'm glad you're alive and well. And I'm glad that you could share your story with us, because there are a lot of doubting Thomases out there, you know that. A lot of people who still feel this thing is over, but you're a living testament, and you've survived it, and you've told us what we need to do. So anybody who knows anybody, please reach out to Prof. Incredible work that you're doing, sir. Thank you so much. And I'm glad that Kano is back on the path to recovery. So that is really good news from your side as well. Ladies and gentlemen, thank you for your time with us this evening. Have a wonderful evening, and God bless. Ciao. Bye-bye.